I'll start, sir.
Yeah, please start.
So good evening, everyone. It gives me immense pleasure to welcome you all to the special program on the occasion of World Bipolar Disorder Awareness Day. India's first free monthly Minds newsletter since 2011, led by enthusiastic psychiatric teachers, undergraduate medical students, and psychiatry postgraduate, has been consistently working towards creating awareness about various mental health disorders. Today's initiative, this online quiz, is just a part of that mission. This program is supported by the Indian Teachers of Psychiatry IToP and the Indian Psychiatric Society IPS Faculty Development Subcommittee, who strongly believe in engaging undergraduate students and psychiatric postgraduates across platforms to strengthen the mental health awareness. Before we begin, let me briefly highlight why today matters. Bipolar disorder is a severe mood disorder characterized by episodes of hypomania, mania, and depression, leading to significant functional impairment. Globally, it affects around 1 to 2% of the population, which translates to around millions of individuals. In India, the prevalent estimates are similar, but due to underdiagnosis, the true burden may be concealed and it can be higher. It is among the top cause of disability worldwide, especially in young adults. Despite effective treatments, the treatment gap in India still remains 70 to 90 percentage, meaning most of the individuals do not receive adequate care. This highlights urgent need for awareness, early identification, and stigma reduction. Today's quiz is a small but meaningful step towards that, aimed at MBBS undergraduates and general population to improve understanding of bipolar disorder in a more engaging way. So let us all begin this academic and interactive journey together. Now, it is my honor to invite our distinguished speaker for the inaugural address, Dr. T.S. Satyanarayana Rao, sir, President of Indian Psychiatric Society, Professor Emeritus, Department of Psychiatry, Jesus Medical College. Sir is a highly respected academician, clinician, mentor, researcher who has contributed immensely to psychiatric education and research and policy in India. Sir, may I request you to kindly deliver the inaugural address?
Good evening, all, and at the outset, I am extremely happy. I am audible?
Yes, sir.
Okay. I'm extremely happy that this program has been thought of. Bipolar disorder is extremely common, and what Madhumita was telling, 1 to 2% of the population. If you just ask me, this figure is only indicator of those people who present with the classical symptomatology. All the epidemiological studies have focused on this. But if you try to look at soft bipolar or varied ways these individuals can present, the number increases drastically. I still remember around 30 years ago, I first published a case report on bulimia nervosa, and ultimately we could trace almost 16 people having this illness, and one of the lady who had developed depression at 103 years of age. As a postgraduate student, I still remember one of the case. I know that particular patient's name also, but I won't tell here now. The presentation was, in fact, people had brought her telling that she takes bath once a week, usually. There are some times in between, she almost takes bath every day. And after about a month to 1.5 months, for another about 1 to 1.5 months, she won't take bath at all for so many days. That was the only clinical symptomatology. In fact, later, a little while our history taking, admission, and further elaboration, we could establish that this particular case was a typical bipolar disorder, cyclically changing. But the only thing, because socioculturally speaking, they were able to recognize only this why she is taking bath every day. In fact, this is not their usual family practice. In fact, they were getting anxious because what is happening to this girl? So what I'm trying to tell you is bipolar disorder is extremely common. We published one case report on consanguinity and mental illnesses. And if we try to look at it, one of the most common possible, what we call genetic issues, if we are trying to talk about, it is highest reported for bipolar disorder. Particularly for monozygotic twins, for bipolar, In fact, there are some studies which go even up to 100% what we call concordance. And more than anything else, say for example, I practice in a place called Mandya, and here the local population, say starting from Mysore, Mandya, Ramnagar belt, we call it. There is a particular community, very high incidence. And if I can recollect number of cases, we treat what we call alcoholism. 50% of them turn out to be what we call bipolar disorder if you have followed them up for some length of time. I'm very lucky because almost around 35, 40 years I'm in this particular place. Those people who presented earlier with some symptomatology, how it has progressed, and many times you might have made a diagnosis of even schizophrenia, but later it turns out to be actually bipolar disorder rather than actually it is schizophrenia. So time to time changes, nature of symptomatology, the mood, how all the ways actually it can present, and that this gets colored to such a great extent because of varied our cultural aspects. And this particular community, very high level of what we call consanguineous marriages. That means one can go from simple point to extreme, and this being awareness about, say, for example, every postgraduate should be well aware of what is actually happening. And if somebody knows bipolar disorder well, I don't tell schizophrenia, bipolar disorder well, that means 50% of your clients are actually in your head. So very narrowly we look into the diagnosis, or in a broader way we try to look into, including, say for example, in case of children, the range of behavioral problems what they present. Sometimes we make it as ADHD to many of these things, and if you try to follow them up a little longer time, I have seen so many people trying to change or not trying to, changing into something different. And the one of the key component one should remember is actually bipolar disorder. I'm extremely happy Kishore thought that this particular thing needs attention, and one of the best area to focus is actually the postgraduates in different institutions, because the sensitization and bringing about awareness is one of the key components. I'm extremely happy Argapal is there, and so many other people from both UG, PG, and faculty people have joined, and IToP is doing a great job. Congratulations at the outset, and I'm more than confident that it will go well, and it will try to bring in that sensitization, what is actually he is focusing to all the people involved and all those people who may be hearing and listening to. All the best. Thank you very, very much for this wonderful opportunity what you have given to me. From our Indian Psychiatric Society, any of such these programs, anytime, even at a very short notice, most welcome. Please go ahead. And I'm extremely happy that 2, 3 sections have joined together. That means this is what is actually expected, and this is what actually going to bring about remarkable changes. Congratulations and all the best.
Thank you so much, sir, for those insightful and inspiring words. Your emphasis on awareness and academic education truly sets the tone for today's program. Thank you, sir. Next, I would like to invite Dr. M. Kishore, sir, Chairperson of Indian Psychiatric Society Faculty Development Subcommittee and Professor and Head Department of Psychiatry, JSS Medical College. Sir has been instrumental in promoting faculty development and undergraduate engagement in psychiatry across the country. Sir, I request you to kindly share your thoughts regarding this session.
Good evening, everyone. It's indeed a privilege to be part of this program. I'm really thankful to the President of Indian Psychiatry Society, Professor T.S. Rao sir, who made possible to come and talk about involvement of undergraduates and postgraduates in particularly bipolar disorders. Today is a World Bipolar Disorders Awareness Day, and the day is marked of one of the world's most famous painters, Van Gogh. And when I went to London and when I saw his painting, which gives remarkable insight into the talent people have, and the color which gets affected because of the illness such as bipolar affective disorder. So we thought that there should be some kind of activity, particularly engaging the medical students. The Minds newsletter, which is 15 years since its inception in 2011, which has actively engaged some of the best psychiatry teachers, undergraduates, and postgraduates. they thought of engaging the undergraduates on this particular day so that psychiatry teachers, postgraduates, and undergraduates together should talk about bipolar affective disorders. And quiz is one of the best ways of engagement for faculty and postgraduates and undergraduates. So, the Indian Psychiatry Society Faculty Development Subcommittee, has an advisor, Professor Pratap Sharan from AIMS Delhi, Professor Pratima Murthy, former director of NIMHANS, are the advisor to our committee. And our convener is Dr. Agya Pal from AIMS Kalyani, who is here, and Dr. Pooja, Dr. Jyotsna, and many other members of the committee. Our primary job is to ensure that faculty interact with the undergraduates and postgraduates in every available platform. So we also discussed this with Indian Psychiatry Society Undergraduate Education Subcommittee. They also were keen to join, and this particular program is associated with the Indian Teachers of Psychiatry, which wants to do a lot of things to improve quality of training in 800 plus medical colleges in India, where more than at any given point of time around uh, 5 lakh to 10 lakh MBBS students are being trained. It's a huge number, and bipolar affective disorder has a lot of myths and misconception among the medical fraternity. One of the major concerns which is coming up is that indiscriminate use of antidepressant by the doctors, because they seem to prescribe antidepressants such as SSRIs, escitalopram, fluoxetine, sertraline, without looking at whether the patient really requires it, without discussing with the mental health professionals, the psychiatrists. So, how do we work with this huge number of doctors who have less or minimal exposure? So we thought that quiz program can be a wonderful way to engage the budding doctors, and online gives us an opportunity to crisscross across India. So it's sheer delight that so many medical graduates volunteer to be part of this particular program and actively participate. I, on behalf of Indian Psychiatry Society, Faculty Development Committee, and the Indian Teachers of Psychiatry, I'm really thankful that this program is taking off in such a short notice. And I hope this program will be useful for undergraduates and the faculty, and also to create awareness about the bipolar disorders. I would also take an opportunity to invite Dr. Agya Pal from AIMS Kalyani, who is the convener of our committee, also to talk about why we should engage psychiatry teachers' involvement with undergraduate and postgraduate. That would be my personal request. Over to you, Madhumita. You can invite Dr. Agya Pal.
Good evening, sir. Welcome to the session. We are very happy and delighted to have you here.
Good evening to all, and it's indeed a pleasure to be
Just
here.
2 minutes.
And it's my special wishes to Professor T.S.S. Rao and Professor Kishore, who have been very instrumental in guiding us about how to go about our ways of teaching both faculty members and students. Teaching is our passion, and that is why probably we are all together in this platform. Today is a very important day. It's a World Bipolar Day. It's the spring festival of all psychiatrists. The Schizophrenia Day happens somewhere around autumn. So this is where we come together. We celebrate the about this very enigmatic illness called as bipolar disorder. And I hope some of you actually chooses psychiatry as their specialty, and they will understand how beautiful and how enigmatic and clinical condition is this bipolar disorder. It has so many faces, it has so many implications, and it doesn't only affect the patient but the family and society at large. The fact that we are celebrating this day on the remembering Vincent van Gogh and his contribution to the society is a testimony to the fact that bipolar disorder actually can involve anybody, any from any age, across any gender, and across any culture. This disorder can be a very important contributor to the morbidity. Enough of me. I hope I pass on the baton to you, and I hope that this program is a huge success and we can again convene on many such programs in the near future. Thank you.
Thank you, sir, for your kind words. We want your wishes to start this program, sir. Thank you so much. And now, moving on to the most exciting part of the evening, which is the quiz. So, your quiz masters for today will be Dr. Aditya Chandran and myself, Dr. Madhumita, second year postgraduates from JSS Medical College, Mysore. We are delighted to host this session and hope to make it more engaging and enriching for both of you. Thank you. Over to Aditya Chandran.
Um, Good evening, everyone. Hope you are able to hear me. So thanks to Kishore sir to letting me host this quiz session. It was given to me in very short notice. I would like to make this quiz as interesting as possible. I don't want it to be another neat exam. So so the questions may not be textbook questions. We'll see. And I think the teams can introduce themselves also. And of course, I want the team members to keep their cameras on because it's a quiz question. And of course, I know you guys wouldn't Google it, but it'd be better to see your reactions. That's also part of entertainment in the quiz. Yeah. Hope you guys are able to see my screen. And team 1, 2, 3 can introduce themselves one by one. Uh, can teams introduce through mic? Is that possible? Like, is there any technical difficulty or anything? And let me know if my voice is clear.
Yes, sir, your voice is clear. Myself, Harshvardhan Bafna. I am from MGM Medical College, Indore. And my
Okay.
teammate is Rishabh Jain. He is from the same batch 2020 MGM Medical College.
Okay. This is team A.
Ashwardhan, you have to come live. They should see you.
Yes, sir.
Team A. Okay. Rahul and Harshvardhan, team A. Team B, Anumita and Anya.
Good evening, sir. This is Team B, Anumita and Anya. We are second year MBBS students from GMC Bhopal.
Yeah. Can you switch on your mic, like your cameras also?
Sure, sir.
Yeah. Thank you. Both of you. Team C, Falgan and Anvi.
Good evening, sir. I'm Falgun. I'm from AS Bhopal. My teammate is still not here, so I guess I might be the only one participating.
Okay. Should we wait for him?
Most probably, I think so. No, sir.
Okay. Team D.
I think Team D has skipped Team E.
Team D is not there, sir. Only
Yeah, E is there, I think. Team E.
Prince
Hello
and
everyone. My name is Sanskriti and my teammate is Prince. We both are from JSS Medical College and we are representing Team E.
okay. Welcome. One, two, three. I think Team A is not there, I guess, on the video.
Guys, we would want everyone on the video, please.
So there are 4 rounds. Since I made questions, assuming there are 5 teams, so each team will get 1 question. Each round have slightly varying rules. So can you see the round 1 slide?
They can also name their teams as we have said, so that we can note down which team is active, so that Madhumita can write down the scores and other things. So just in front of your thing, you can change. Vardhan, you can also name your team. If your batchmate is not going to come, you can just this whole quiz is to encourage you. There are some goodies also, and I hope you will enjoy in the quiz. So just mention your team name so that it is easy for others to cross over.
And you can change your team name in your name also, Zoom name also. That would be convenient for us.
Yeah. Yeah.
So round 1 is no negative marks are there. Each team will get 1 question each. Each question has 10 marks. There's no pass on. There are 4 options. Within the 4 options, you have to choose. Okay. I'll start. And each question duration is 40 seconds.
And
So
also
within
audience round. You want to tell about audience round
yeah.
also?
After there are 4 rounds. After each round, I'll give you one. There are audience round also. You can keep your camera and mic on, and that time you can answer them. So there will be 4 to 5 audience questions also. Okay. I'll start with my first question.
Like, how are we supposed to answer the question?
So team A, the first question will be pointed towards team A only. The first
Okay,
question will be for team A. So the team A can respond through the mic, and
okay,
the timer will be counted by Madhumita.
okay,
And video should also be on throughout.
Yeah.
okay.
So once he finishes the question, I'll start the timer. And once it's ending, I'll just say time's up. So you'll also know.
Sir, my teammate has joined just now.
That's good. That's good.
Even if you are in different places, don't worry. Just put your team name, and it is left to you who among you wants to answer, so that it's easy. But the person should be live, and everybody should be able to see when your question is being targeted for your particular team.
Okay. So the question for the team A, team 1, is that fine? I'll start. I'll start. I'll start with the team first question. Is that fine?
Yeah,
Okay, fine. Uh, so first round is fully historical related questions. So which ancient Greek physician is credited with the first linking melancholia, which is depression currently, and mania as different expression of the same biological root?
B. Arrhetius of Cappadocia, I guess.
Yeah, that's right. Okay. I'll move to second question.
Is it for team A again or
Yeah.
for team B? Okay.
No, this is second question is for team B.
Okay.
Okay. Team B is okay. Team B.
Anumita and Anya, are you there?
Yes.
Yeah. Okay.
In 1850s, Jean-Pierre Fallret and Jules Belger independently described this condition. What was Falret's specific term for it?
Sir, option B. Sir, option B.
Yeah. Which is also, this is Foley double formate, which is also called circular insanity, which is a term now currently called as bipolar disorder. Okay, I'm moving to the third question, which is for team 3, ABC. Okay.
Falgun and Avni, are you there?
Yes, ma'am. And
Yeah. Okay.
Okay. According to DSM-5 TR criteria, what is the minimum duration required for distinct period for abnormally elevated or irritable mood to qualify for manic episode?
1 week. Option C.
Yeah, correct. Uh, for the team 4, okay. Team 4 is
Yeah.
there, right? Team 4 is there, or is it team 5 only? Madhumita, the team 4 irka na?
I think it's Sanskriti and Prince only. Team 4 Sir told skipped, so we'll keep the team 4 as Sanskriti and Prince.
Okay, fine.
Sanskriti and
John,
Prince are
I'll read out the question. Okay. John Catt discovered the mood stabilizing effects of lithium in 1948. While experimenting on which animal did he use?
B. Guinea pigs.
B.
Option B. Guinea pigs.
Yeah, that's true. After he injected lithium carbonate, he found that the pigs got lethargic. Okay.
Yes.
Um, since team 5 is not there, I will show this question to open. There are no marks for it. You can just try it out, and the first one you can try it out. Okay, there are no marks for this.
Aditya, give it to the audience,
Sure,
not
sir.
to the participant. Let the audience.
Okay. This is the question. Which of the following modern findings weakens the validity of Kraepelinian's dichotomy? Anyone can answer this.
Sir, is
Please
it
respond.
option B?
B option.
Yeah, correct. It's overlapping genetic susceptibility between schizo and bipolar. This was actually audience question. This is directly from CTP. Senjin Shuaru, it is a Chinese term for a disease characterized by lassitude, pain, poor concentration, headache, irritability, and weak nervous system. It was earlier thought due to the pressures due to modernization. What is it called now?
Is it option D, neurasthenia?
Yeah, right. Which team was that?
No, I'm not in any team.
Not in- Yeah.
Okay, fine. That's right.
Mokshita, you can tell where you're from.
Good evening, everyone. I'm Mokshita. I'm an intern at JSS Dental College.
Oh, welcome. Nice to know.
Thank you, sir. It's an honor to be part of this.
Okay, going on to the round two. So, actually, I just messed up with the slide of round two and round three. That's fine. The round two will have negative marks. Okay. The negative each if you wrong answer will get -5 marks. There are no pass-ons, and each correct answer will get 10 points. Is that fine?
And go in a reverse order, Aditya.
Sure.
Now, E1 can start.
Even can start. The image round will come in the round three. Okay. So I'll start with the team D. E1, sorry, I mean. I'll start.
Yes, sir.
Okay. So which clinical feature is primarily differentiated between bipolar 1 and bipolar 2?
B, presence of at least one maniac episode.
Yeah, that's right. They get 10 marks. So the next question goes to team C. Team C is ready.
Yes, sir.
Okay. The functional imaging in bipolar patients often shows top-down dysregulation. This is typically involves an overactive dash and an underactive dash.
Sir, pass from my side. Just want to ask Arvind.
Answer is pass.
Yes, sir.
Okay, fine, pass. So you guys wouldn't get any minus or you wouldn't get 10 marks. Uh, anyone wants to answer?
Sir, team B wants to answer.
Sir,
And A.
sir, just a second. Team C1 wants to answer.
Sir, team B.
Amygdala and prefrontal cortex.
A.
This is team.
Team B, option A.
Sir, team C1 I was answering. Amygdala and prefrontal cortex.
Okay.
There is
So
there is no pass for
There's
this.
no pass on for
Only
this. You can
negative mark.
answer it, but there's no marks
yeah,
for it. So
okay.
you need not worry. So the answer is amygdala and prefrontal cortex. Okay. Next, I'm going to go on to team B. Okay. You guys are ready?
Yes, sir.
A patient has experienced 5 distinct mood episodes, three depressive and 2 hypomanic within the last 12 months. What is the clinical specifier for of this pattern?
Sir, option B, rapid cycling.
Yeah, that's right. You get 10 points. So the next question is for team A. I'll start. I'll start for team A.
Yeah.
Rapid cycling is correct. By definition, it's 4 or more mood episodes within a single year. Okay, so team A. Before it was bipolar disorder. What was the primary term used in DSM-1 in 1952 and DSM-2 in 1968?
Hmm.
Is it maniac
No.
depressive reaction? Option B.
Yeah, it's right. The answer is manic depressive reaction. You get 10 points. So I think except for team C, everyone gets point in this round. Right?
Yes, yes.
Uh, so
Sir,
next, yeah.
sir, actually, Avni was answering that as I'm not currently with her. So, does that work out?
I don't understand.
Avni, like she's part of my team and she's currently not with me. She was
Okay.
answering the question. I was telling ki I don't know the answer, but I'm asking Avni that if she knows anything, she can answer.
Okay. She knew the answer. She didn't answer during her
No,
chance.
no, sir. She answered, sir, like, but she was telling something.
Madhumita is the
Madhumita, can you
third
clarify
person.
what
She can
exactly?
decide whether to give or not to give.
So she actually came to the video and she told within 40 seconds, but it was also told simultaneously by another team. When we told the person who came on the video, he told it was a pass from his side. So when he told
Okay.
pass, the other team came into the video and they also told the answer simultaneously when Avni was about to tell.
Yeah, so pass is pass. You are right.
Okay.
So the team may not get marks. Next time.
Okay, sir.
I'm not able to see the video film
Or,
because I'm presenting, so I can't judge. So Madhumita will take the decision.
So next time, before you tell the word pass, just make sure you're also like talking with your co whoever is being with you.
Okay.
Yeah, wait, go to the next thing.
Next is for open for audience. This is actually for team 5 question. Simbiax, which is dash, which was first treatment which was approved by FDA specifically for acute bipolar depression in 2003. So what is this Simbiax?
Is it option A?
Yeah, that's right. I think this was answered by
Mokshita.
The same person who answered earlier.
yeah. Okay. Actually, there's an error in the question. It's fine. Okay.
So teams can also answer this.
No, there's no marks
Oh,
for this. It's just
that's audience.
audience.
Okay.
This is again an audience question. Since initially they told me there are 5 teams, so one question is coming extra for everyone for audience. So that's the thing. This is another audience question. In Japan, there is a DASH, a non-invasive portable neuroimaging technique that measures cortical hemoglobin changes to assess brain function. In psychiatry, NIRS is the used to differentiate between bipolar disorder, major depression, and schizophrenia by analyzing specific frontal lobe hemodynamic responses during tasks. This is not used anywhere outside or it's not diagnostic of anything. What is the instrument?
Is it option C, optical topography?
Yeah, yeah. Okay. Going on to the next round, round 3. In this round, there will be -5 marks and there is pass on. This is imaging. Image questions will be there. Okay. Mostly drug related questions in this. Is that fine? There is negative marks of 5 and there is pass on.
So whoever comes to the screen first and tells me that I'm gonna tell, I'll be taking that team's answer only.
No,
So
it will go in order only.
yeah,
Teams.
it will go in the order only. But if the person is not able to answer and if he gives a pass, it will be open for other teams. So whoever is coming on the screen and telling the answer first, I will be recording their response.
So when they say pass, it should go to the next team. So now the round can begin from A. If they say pass, it go to B1. If they
Okay.
pass, it will go to C1, like that.
Okay, sir. Okay.
Excuse me, I have a
Sir,
doubt.
there is
Can the
negative
audience
marking
also
also.
partake in this round?
Yeah. They like not at the end of the round they can participate, not
Okay, all right.
initially.
Thank you.
Sir, there is
Mm.
negative marking also.
Yeah. Negative is there.
Plus 10 and minus 5.
Yeah.
Ma'am, just to clear, so if some team is not able to answer and they pass, it will go to the next team, not open to everyone.
No. It
Not
will
to.
to the next team.
Okay, ma'am.
Yeah, so just other teams don't intervene in between, okay?
So it will go in order only, A, B, C, D only. Okay. Madhumita, I'll move on.
Yeah. Move to the team A.
Yeah.
Are you there?
The first question is for team A.
Team A.
Yeah, we are there.
Okay. Aditya, you can go.
Yeah. Which drug's mechanism of action is marked here in the X?
I guess it's valproic acid. A.
Yeah, the answer is right. It's valproic acid. You get 10 points. And moving on to the next question.
For team B?
Team B.
Team B, are you guys there?
Yes, ma'am.
Identify the following molecule.
For C, is it option C? Topiramate.
C is wrong. It's for you -5 marks. Team B.
Can it pass on to the next team, team C?
No. Once you answer, it can't be passed on.
Okay.
Okay. Going on to the next question for team C. Team C. The answer is carbamazepine. Okay. Going to team C. You guys are ready?
Yes, sir.
What is the primary mechanism of action of endoxifen in managing acute mania?
Sir, is it inhibition of protein kinase, PKC?
Yeah, that's right. Guys get 10 marks. Okay. Team B, sorry, team D. You guys are ready?
Yes, sir.
28-year-old female on bipolar treatment develops severe rash, life-threatening rash. Which medication is most likely responsible for this?
Lamotrigine, option D.
Yeah, that's right. So Team D gets 10 points. This is for whoever wants to answer. It's open. Okay. Which signaling pathway is major target for lithium, specifically involved in inhibition of enzyme that regulates the WNT pathway?
Is it option C, GSK3 beta?
Yeah, that's right. Who answered it?
It's Mokshita again.
Okay. Uh, this is another open question for the audience. Okay. Anyone can answer. X is the name of a band formed in the year 1987. Why was song released by the band in 1991? Was fictionalized account of a man who turned to religion as a last resort to keep himself alive after the death of his girlfriend, to keep him from suicide. What are X and Y? The image is the album cover.
X is Radiohead. I'm not sure about Y.
Okay. Who answered this? You can introduce yourself.
This is Mokshita.
Okay. Anyone else wants to guess? Radiohead is wrong, actually. Radiohead is wrong. But it's a good guess. Yeah. Anyone wants to answer? Take a guess.
This is Mokshita. Is it Nirvana by any chance?
Yeah, it is Nirvana. X is Nirvana. Y is?
Um, I'm not sure about Y.
Okay. X is Nirvana and Y is Lithium. The song's name is Lithium. Okay. So coming to the last and final round, this is again similar to this round, but this will go from D. The questions will start from D. This has -5 marks, and if you don't want to answer, you can pass it on. For each question, you get +10 marks. Is that fine?
Yes, sir.
So for telling wrong answer, it is minus. If you pass on, you don't lose anything. Okay. So this is for team D. Okay. Team D. Not team D is ready.
Yes, sir. Yes, sir.
Okay. Identify the following speech pathology which is depicted in the diagram.
Flight of ideas, unnecessary. 1 second. Sir.
If you jump, it will give you a minus.
Your time is up.
Okay. Your time is up. You get no marks.
How
It
much
passes
time we
on
get
to
to answer a question?
yeah.
How many
Yeah.
seconds we get to answer the question?
40 seconds.
Oh,
Will it be passed to team A or
Team C,
Team
actually.
C.
okay?
So do we get negative marks for answering this question?
Yes. Yes.
Circumstantiality.
You're sure?
I think so, sir. Maybe.
Okay. Circumstantiality is right. Team C gets 10 points. Next question goes to Team C. Okay. So Team C gets 10 points, and the next question is also for Team C. And Team A gets 0 points. I'll go. Team C is ready.
Yes, sir.
Okay. Which of the following is the strongest predictor of recurrence of bipolar disorder?
so this question is for team C.
Yes,
Yeah,
it's
yeah.
So, sir, poor medication adherence.
Yeah. That's right. You get 10 points more.
Okay.
Next question is Team B. Team B is ready.
Yes, sir.
Okay. A 30-year-old patient with undiagnosed bipolar disorder is started on antidepressant for depressive symptoms. After 10 days, he develops increased talkativeness, decreased need for sleep, grandiosity, and excessive goal-directed activity. What is the most likely explanation for this clinical change? Natural progression of bipolar, antidepressant-induced switch, serotonin syndrome, or non-compliance with medication?
Sir, is it option B?
Option?
B.
Uh, yeah, that's right. You get 10 points. Team B gets 10 points. Okay. Team A, are you guys ready?
Yeah.
In Hagop Akiska's spectrum concept, what is bipolar 4? Is it mania induced by substance abuse, hypomania induced by antidepressants, a lifelong hypothermic temperament with clinical depression, or rapid cycling bipolar 2?
Excuse me, is it option number B?
No, नहीं यार. Like we need to. मुझे सी लग रहा है. Yeah. Let's go with B.
B?
Hypomania induced by antidepressants.
Yeah, we will go with B.
B is wrong. Answer is C. You get minus 5 points. Okay. Team A, right? This is Team
Yeah.
A gets minus
Yeah.
5 points. Okay. Next is for open. Anyone can answer. There are no marks for this. Anyone can answer. Okay. Uh, Robert posed a killing hypothesis compared to the progression of affective illness to the repetition of seizures. Which part of the brain? What is the answer? Hello.
Amygdala.
Who answered that?
The team C1.
Team C. Yeah. Answer is amygdala. You're right. You get no points. That's right. This is audience. Anyone can answer. Okay. Ram is a character from the Tamil movie Dash, played by Dhanush, released in the year 2012. He suffers from bipolar disorder in the movie. What do his hallucinations tell to him? What treatment procedure is shown in the movie? So there are three parts to this question. If anyone wants to answer them all together, tell that first. If only parts, you can tell later.
The movie is 3. He suffers from what was it? Hallucinations, if I'm not wrong.
No, that is there in the question.
Okay, so what is the specific question?
What
What
do
do the
his hallucinations tell him?
Okay, hallucinations tell him something about the girl he loves or something like that.
Yeah, partially right.
He fantasizes something about her, which is not exactly true. I do not remember. This was very long ago.
What was the procedure shown?
It was was it electroconvulsive therapy, if I'm not wrong.
Yeah. Yeah. Who's this?
This is Mokshita.
Okay. Okay. Then we'll give some chance to others also. Yeah. Yeah. The movie is 3. The procedure shown is ECT, and the hallucinations he sees ask him to kill himself or to kill his girlfriend Janani. Okay. So all the rounds are over as of now. Madhumita will calculate the score and let me know. If there are ties, we'll have additional questions.
Uh, okay. So from all of the 4 rounds, the team 1 has scored 25 points. That's team A has scored 25 points. Team B has scored 25 points. Team 3 is the winner with 40 points, and team D is the runner with 30 points.
Congratulations, fantastic. Would they like, would all of them like to comment upon their experience? Aditya, you can close the screen. Or if you want to talk about it, you can talk about the last slide and allow people to interact by closing the screen.
Nothing much to say. I just wanted to say, while making the questions, I just wanted to know whether the questions were too tough or whether entertaining at least. Um shouldn't be another neat like question. There are a few more questions. If you want, we can have them for team A and B if they are okay with it. This is just a quote by John Perry Palret. Um, so I thought it was nice, so I posted that about mental illness on specifically it's about bipolar. Thank you, sir. Thank you all. I hope you guys found it interesting, I guess. Thank you.
Any words from the participants? If you want to comment on anything, you are open.
Good evening, everyone. This is Mokshita. So this is my first time officially engaging in such sort of content or quizzes. I think it was a lot of fun and it was very well organized, and I think I got to learn a lot of new things as well. So yeah, that's my opinion.
Thank you, Mokshita, for your active participation, being an audience, and being from a dental college. This means a lot that you know a lot of things.
You
And
can close the
Mokshita,
screen. Aditya, your
yeah,
screen is on so that people can't see. You can close it.
and Mokshita can tell how she's interested in bipolar, being a dental student, like it'd be interesting.
So originally, I really did not want to get into medicine or dental. I was leaning towards psychiatry and law, and because I could not make up my
Come live,
mind.
Mokshita.
Just a minute, yes. Um, Hello. Hi. I'm walking on the road, so the lighting is a bit distorted. Yeah, so I've always wanted to just help people out. That is the reason I got into the healthcare field. And I read a lot. Ever since I was little, I read everything that I can get my hands on. And since in internship we don't have much work to do, I've been getting more time to read. So that's how I came to know about these things.
Fantastic, Mokshita. I
Don't know.
think you
So
should
this was
run the
very
book
wonderful.
club. You
No,
should
so
run
you're
the
too
book
kind.
club at the dental college. Yeah,
No, you're too kind, sir.
yeah. I think all the participants can share their experience one by one. Then Madhumita and Aditya can share the experience, and Agyapal and me, and then we can conclude. If any audience wants to say something, yeah. Team A1, they can start.
This is Rishabh from MGM. I really like the experience, but I found the questions a bit tough to be like on the UG level. And yeah, I would have like a bit more longer questions, like which were more clinical. But yeah, it was a good experience to be here. And also, like we can have a round in which there is some time constraint, like every question was like the one who answers first, like one a question which is open for everyone, and the one who answers first gets the point. That would have been a good addition to the quiz.
The difficulty is that if it's a face to face, we can have a buzzers and we could do a lot more.
Yeah,
But since it's online, it's very difficult to monitor who's answering. And we did have timer. It was 40
yeah.
seconds. Maybe we could have had it for 30 seconds since we had options also. Uh, I thought it was you guys answered everything, so I thought like during the question, I thought maybe I made it too easy, is what I thought. So yeah.
Uh, yeah.
Thanks for the feedback. And MGM Indore is the key area for Minds newsletter. So
Yeah.
your presence in that team means a lot to this particular effort. Thank you, Harsh.
Thank you.
D1.
Good evening, everyone. We had a lot of fun and we got to learn a lot. And especially as second year students, we don't get a lot of exposure to psychiatry. So it was a nice first exposure and read more on this now. That's it. Thank you.
Team D, Team C should be there.
Good evening, everyone. First of all, thank you for Minds Newsletter for allowing me to participate in this event. Actually, I myself suffered from bipolar disorder when I was in my first year, and I guess it's been a lot of change for me to come here and to give a quiz here on World Bipolar Day. Thank you.
Thank you, Vardhan. Next.
It was a great pleasure to be a part of the quiz. We know that this club organizes n number of events and n number of quizzes. So we also would like to extend that you all should participate even more because the amount of effort they put in to bring all these things is amazing. And this is also our first time that we thought that we should participate in quiz, and it was really amazing. We learned a lot and it was fun. It was not like sir told that they won't keep it like neat and stuff. We were preparing it in a way that it will be a clinical quiz and all that, but it was very interesting and fun. The movie section, the music section, all of those questions were also added. And to all my fellow friends, I would like to tell you that JSS organizes a lot of activities, especially under Minds Club, so you should participate in this. It will be very fun. Ours is also the first time and it was great to have you all here and be a part of this quiz. Thank you.
Madhumita, you are the person before Aditya talks. Madhumita, you're muted. You're muted. You have to unmute.
Yes, yes. Sorry for the inconvenience. This is my first time being as a quiz master in my life ever. It was like I had to come up with what to do, and we discussed a lot about that. But it was really great and nice seeing like participants from various colleges and various states coming in together and participating. We would like to do more of these frequently in coming years, and I'm also looking forward to it. Thank you, sir, for the opportunity.
Aditya, the quiz master.
Thank you, Kishore sir, and everyone who participated for giving me the opportunity. I have participated only in movie quizzes, and only that I know. So I wanted to be more entertaining. I hope you guys enjoyed. This is my first time conducting a quiz, so it was, if any mistakes, to forgive. We'll make more quizzes also in future. Thank you all.
You are like a movie star, Aditya. There is an illumination behind you. It is as if a celebrity has come and giving his remarks. So it's good to see you and your love for movies and then your love for quiz. I would request Dr. Agya Pal to give his opinion.
Thank you, sir. It was wonderful to see so many questions being answered successfully. And so I was just thinking whether I was there as an undergraduate student in this quiz. I don't know whether I would have been performing this well, but it was very heartening and it was a very neck to neck quiz. Aditya and Madhumita, you did wonderful. Madhumita and Aditya, you spoke with such composure. It's not easy to hold the audience together on a virtual media, but you did wonderfully well. Uh, but then one piece of advice that I would want to
Thank you.
give is that it was such a neck-to-neck quiz. If you were aware of the status of the teams in between, that would have been very good. So we never knew that quiz was so close before the last round. So that would have added to the suspense. And so that is my only suggestion to you. But then we are all starting off. So even doing this on an online platform, and we all probably are bound by this love for knowledge and freedom. So we will probably be meeting again and we will improve. And I understand you have done this on a very short notice. Hats off to all of you. Kishore sir, what can I say about your guidance and your leadership? This is another testimony to this. And it was wonderful. It was very successful, and I think everybody enjoyed it. Thank you, sir.
Yeah, it's a delight, and I would like to thank on behalf of the Indian Teachers of Psychiatry and Indian Psychiatry Society Faculty Development Committee, as well as Indian Psychiatry Society UG Committee, and the president himself was there. So, first of all, you'll all receive the e-certificate signed by the president. He will send you, and you will also get some goodies for the marks and other things. We had not thought that this can go in such a nice manner. We also understood when people are honest and they are keen to engage. This is totally new, which we have also not experimented with. So, as Dr. Agyapal said, we will talk about this experience to the faculty, that why they should engage with the undergraduate students all through the professional course on particular days where we want to create awareness. It's a new model. I'm immensely thankful to Dr. Aditya Chandran and Dr. Madhumita and the wonderful audience, Ishani, Anirudh, Dhananjay, and so many of you who are there. And I was surprised somebody like Moksha coming from dental college, passionate, also participating very actively. This tells why we need to connect with the undergraduate medical students and dental students and healthcare professional. We learned a lot. I hope this session will give us all opportunity to spread the message of creating awareness about bipolar disorders. So now I would like to conclude. Thank you one and all for joining on this evening. Perfect timing. Within 1 hour, we have completed. Amazing thing. And you will receive your certificates shortly and goodies. Thank you so much. Thank you one and all.
Thank you all.
Thank you, sir.
Thank